Thank you so much, Gila. Welcome, everyone. So even just before we start, I'm going to start with the caveat of if you are comfortable with your cameras on, please feel free to leave your cameras on. And if you are more comfortable with your cameras off, this is a judgment-free zone, okay? So I see some people are on, some people are off. And as Gila mentioned, this is being recorded. So just to keep that in mind. And without much further ado, welcome to our first Grandparents Zoom. As part of Yesh Tikva, one of our goals is to provide support not only to the individuals and couples impacted by infertility and pregnancy loss, but to the entire family system. So it's really a privilege to be here tonight. As Gila mentioned, my name is Rachel Fryman. I'm a professor of social work at Yeshiva University's Wertzweiler School of Social Work. And in my personal life, I went through infertility and pregnancy loss. And I think in many ways I'm still recovering, and professionally am not involved in infertility in the infertility world. So I really do look to Deborah and Sahar and Kenzie as the experts here. But as Gila mentioned, for the past 10 years or so, I've been a fertility friend at Yesh Tikva, a volunteer, a cheerleader, and really privileged now to be sitting on the board thinking about the future of Yesh Tikva. And that future really includes everyone here, your friends, your family, and providing education and resources to really empower our individuals and couples navigating it and the entire families. So without much further ado, I'm going to turn it over to Kenzie. She's next to me, and we'll each introduce ourselves and maybe talk a bit about your connection to Yesh Tikva, and we'll go from there.
So I'm Kenzie Locks. I'm a licensed clinical social worker in New York, as well as a health and wellness coach of all things. And I have the wonderful honor of being the director of educational development here at Yesh Tikva. It is a true honor to support folks as they are walking through really some of the hardest times in their life and in their family story, and trying to create support for resources for them, as well as their circle, which is all of you. So thank you so much for spending your time here with us.
And next, Sahar, Dr. Wertheimer.
Oh, thank you. I am a fertility specialist at HRC Fertility in Beverly Hills. I trained at Einstein in New York for my residency, and then came here for fellowship, and got swindled into living here by the better weather. And I'm still here, and also very honored to be a part of Yesh Tikva's events here and there. And thanks for having me.
Thanks so much, Dr. Wertheimer. Deborah Paul.
Hi, everyone. I'm Deborah. I am a certified genetic counselor. I work currently for a lab based out of California known as Luminary Genetics. It's what's known as a PGT lab, and I'm sure we're going to get into a little bit more as to what that is and how that might be a part of your children's fertility journeys. But I got connected through Gila to Yesh Tikva. I've always been very passionate about providing my knowledge and expertise to help support the Jewish community. So I'm really grateful and excited to be here with you all today.
Thank you so much, Deborah. So really, this is an interdisciplinary team, which means we have medical covered by Dr. Wertheimer, really looking at reproductive endocrinology, and hopefully we can learn more about how that is different from an OBGYN that might be the more typical provider that people go to when they want to have a baby. And Kenzie Locke is going to be covering more of the social, emotional, the mental health piece. And we have Deborah. And Deborah, I can't say enough about genetics and understanding the role of genetics in our reproductive journeys. So really being able to take the science of genetics and explain it in a way that's compassionate and palpable to people who are not in the sciences. Is that a helpful way of breaking it down? And together, we're really just going to have a conversation. And hopefully, as Gila had mentioned, you can come back and listen to it and process again. But really, this is an opportunity to think about who your children might be going to as they're navigating fertility, and what the different professions and the roles are. And with that said, let's maybe turn to thinking about what is each of yours scope of practice within the context of infertility. What does it look like when you are starting to work with an individual or a couple kind of beginning their journey? Maybe-
I can start. So
Yeah, please.
I commonly see patients who have either been sent by their OBGYNs or by their friends because they spoke about, what's been bothering them, and we're entering an age which I think is really great of awareness and breaking the stigma. And I think more and more patients are coming from referrals from friends and family members that have gone through similar things. And by the time they've come and then I have some patients that are just kind of like they know something's up or they want to check in on their fertility. But usually, what I do is take basic education on their fertility, what's normal, what's not normal, what are things that I can help you with, what are the different levels that I can help you with. And I will try, if any of the evaluation shows something obvious that may be causing infertility, like thyroid disease or blocked tubes, we can specifically target that one thing. Um, if a couple ends up needing a small surgery, we do hysteroscopies, we do saline ultrasounds, like small procedures to help with the evaluation. And then ultimately, we do treatment like ovulation induction, which is pills paired with intrauterine insemination or IVF.
So really, this is the baby making part of a pregnancy, right?
The
So
baby making
following
part, yeah.
through, is it the end of the first trimester, hopefully, or
Yeah,
that?
good question. Usually towards we see patients until about 10 weeks. And they often describe the transition from going from seeing an ultrasound of their baby every week to not seeing any at their OB until, their first trimester screen, which is about 13, 14 weeks, and then again till their anatomy screen is very scary. But in the world where you didn't come from a background of anxiety and you just kind of got pregnant or whatever, that's more normal. But our patients always tell us they actually don't like it when they're not nauseous. My patients are always complaining when they're not nauseous because the nausea is a reminder that they're pregnant and that everything's working. And they constantly like to check in, and it's yeah. So we see them till the end of 10 weeks. I always tell them I don't necessarily need to, but if it's reassuring for you, come back.
Thanks, Dr. Wertheimer. Deborah.
Yeah, genetic counseling as part of the IVF process is kind of somewhere in the middle of all of that. So there is genetic testing, PGT, which is the type of genetic testing that our lab performs, stands for pre-implantation genetic testing. Essentially, it's just a phrase that refers to genetic testing that's done on embryos. So once an individual or a couple has created embryos, samples of those will be sent to our lab for the genetic testing. There's different types of genetic testing we do. There's kind of standard as part of your IVF process testing for chromosome abnormalities. That's known as PGT-A for aneuploidy. And then there's PGT-M, which stands for monogenic conditions. Those are for individuals who are pursuing IVF because they know that they have a genetic condition themselves, or they and their partner are carriers for the same genetic condition. So if two individuals carry Tay-Sachs or cystic fibrosis, or if somebody has a BRCA1 or 2 mutation, they may be doing the PGT-M test. So we're kind of somewhere in the middle. A patient's already decided and started to move forward with the IVF process. And we're counseling patients typically on results from the general chromosome testing, or working with patients through it's a pretty involved process of PGT-M testing, building a test, getting results for those, the whole process from start to finish. We're really involved in that. And then we kind of pass it back to the doctors for transfers of their embryos once they've had those results come back and understand a little bit more about what the potential risks are that are involved, what their results mean, and using that information to make decisions around their transfer of their embryos.
Thank you so much, Deborah. And in general, genetics can be involved from very early on, like, and maybe if you could speak for just a minute about that to understand how a couple who might have done genetic testing while they were single, or maybe their parents at this point had done genetic testing and they're aware of genetic abnormalities in the family, what maybe a genetic counselor might do in a practice where they're not necessarily sure they're doing IVF yet, but they know something might be a little fishy.
Yeah, so a lot of individuals, especially within the Jewish community, pursue what's known as routine carrier screening. They're looking for those single gene conditions. These are usually conditions that individuals carry silently. So usually you're not affected with these conditions, but you carry it silently and you wouldn't know until you pursue this genetic testing. It's typically done a lot of times on college campuses today. JScreen is a great resource that does this genetic testing across the country. But a lot of individuals are also doing it when they're ready to start thinking about having children. And so at that point, that's when a lot of individuals discover that they themselves and their partner are carriers for the same condition. In that scenario, a lot of individuals will talk to their genetic counselors in those settings. So either a genetic counselor at JScreen or a lab that did their genetic testing or their OBGYN or gynecological provider who ordered the testing for them. And typically that's kind of a more in-depth conversation about what do these results mean? What's the risk for having a child that's going to be affected with one of these conditions? What do those conditions look like? And what options do we have moving forward with the information that we now know about this risk? And so that's the carrier screening aspect of it. And I'll let you know, when two people are carriers for the same condition, there's a 25% chance that their child will be affected with that condition, a 50% chance they will themselves will also be a carrier, and then a 25% chance that they will be unaffected and will not have the condition. So, everybody makes decisions differently, but a lot of people then decide to pursue IVF to test embryos for those conditions to determine if an embryo is affected, a carrier, or unaffected, so that they can, with a higher degree of certainty, move forward and hope for a healthy pregnancy with a child that's not affected with one of those conditions.
Thanks, Deborah. Thank you so much for spelling it out. And this is, I think, something for grandparents to and someone who was, tried starting my family before genetic testing was this advanced, that knowledge is really power here. That before, couples might have been having these miscarriages, not understanding why, because the panels didn't necessarily pick up on the chromosomal abnormalities. And here now we can test for them and plan for them. And Dr. Wertheimer and her colleagues can now engage in IVF and different practices to then make sure that the couple is not necessarily a carrier if they don't want to be. So really this knowledge is power, and it's new power. 10, 15 years ago, it was just developing. So this is really, really cutting edge. And, I think for people who were in a different generation, this could be really helpful. So thank you, Deborah. And Kenzie.
I was having trouble unmuting. So I'm not a doctor, and I am not helping anybody have a baby in that sense, and do all my deferring to these lovely experts on that field. But I'm here from the mental health point, because what we're talking about with folks who are experiencing infertility is typically it's traumatic. It's incredibly stressful. Uh, it compounds a whole lot of issues. And so they're often carrying around an invisible grief. Nobody is acknowledging it in the way of, oh, somebody very close to you passed away. I want to take care of you and bring you food and check in and all these important things that we do to support our loved one. It's completely invisible unless they choose to tell others. And even so, if they choose to tell others and bring that in and bring those people in, there's often not necessarily the response that they need, which I'll get into a little bit later. But we're often talking about feelings of shame and often isolation. And so compounded with, I hope you understand just in the briefest of ways that these two lovely professionals just shared the process of making a baby when you have infertility, it's so much effort. And then to have the stress of all that effort and hoping it's going to work, and the finance of all that effort, and trying to maintain friendships and jobs and relationships and marriage and everything else that goes along just in general life, on top of, well, now we need to have major medical testing and procedures getting done and hope that this works. I'm stressed just thinking about it and talking about it. It's very stressful. And so that's where I come in, and where really Yeshtikva comes in, is we are here to provide resources. We have resources, like I said, for grandparents in waiting as well, and how to support your kids as well as how to support yourselves, because we also know it's stressful for you, and I'll get into that as well later. But we have a number of peer support groups that are very specific and are very well attended, that anyone can come into while they're going through infertility or after they are parenting, hopefully, and through different methods. We have amazing groups. We have a mentorship program where called Fertility Friends, where folks who have been through infertility and are on the other side of their infertility journey are mentoring folks who are in the thick of all of these medical procedures, and hoping to get to that place. So really, we're here trying to see the invisible grief, shine a light on the invisible grief for the community, for these folks' loved ones, to try to break stigma, especially in the Jewish community, because while we are an incredibly loving and supportive community, we also struggle, like any other community, with what is a very stigmatizing topic. And really just hoping to help folks understand that this is not an easy thing to go through, and it is so common. We're talking about 1 in 6 people will be affected by infertility. This is not uncommon, but just because it's not uncommon doesn't mean it's not painful. It's still very isolating and very painful.
Yeah.
And so trying to work out how to support folks while they are going through this medical piece, how to care for their brain and their heart while these lovely doctors are caring, and these geneticists are caring for their body. We're trying to really take on this holistic approach. So
Thanks so
that's
much,
what I would say
Kenzie. And I
mentally.
really appreciate something Dr. Wertheimer mentioned earlier, that it is more public today, that
Yes.
you see the social media and friends talk about it more openly. And I think Yeshtikva has been an important part of that conversation for a decade. But it used to be really private. I remember when I was living in Manhattan, you'd go into the waiting room and you'd see your friends and you'd see your neighbors, and no one would say a thing. And it was like this hush hush, like you saw each other, but your heads were down. And over the years, I think something that's really been amazing is that for people who choose to share, there can be community, and for people who choose to keep it private in whatever way that they're processing their grief or their feelings, and they can be really complicated, is that there are private venues, like having a therapist, like having the Fertility Friends, and kind of like a formal mentorship program. That's really, really great. Thank you, Kenzie. So with that in mind, I think it would be really helpful to kind of pivot to what would be helpful for grandparents to know about our different professions and how we work with the couples that come to us. So with that in mind, what do you think would be helpful for each of you to be able to share about your professions for the challenges that couples are experiencing when they come to you? Because, as Kenzie had mentioned, there's the financial commitment, right? Dr. Wertheimer didn't talk much about that, but the cost of the IUIs and the IVF, the medications involved in this, and the different procedures, as well as the toll that it takes on our physical bodies, right? And our emotional well-being that Kenzie kind of started to think about. So maybe if we can just spend the next little while kind of brainstorming and sharing what, as the providers, we think would be helpful. And maybe we can start with Dr. Wertheimer.
Okay, thank you. So definitely financials are always helpful. I don't know anyone that says, no, it's okay, we got this, That being said, not everyone's, there are very expensive treatments, and not everyone's in a position to lend help in that way. I think emotional support goes a very long way. What I think is very helpful is, from what I've seen from my patients, I think that different generations have a different way of handling stress, and of handling the doctor's advice, and of handling how to react to somebody who's in stress. And I speak from my own experience and not judging anybody here, but I know that when I want to talk to my mom about my problems, she wants to problem solve for me. And I think that sometimes as a support person, we just want somebody to hear us out and not problem solve for us. And as the doctor of the patient whose mother wants to problem solve for them, I will say sometimes it feels like adding another cook to the kitchen and just becomes really more overwhelming for the patient. And some patients shut down and they almost can't move forward because there's a million voices in their heads telling them maybe you should try this supplement and maybe you should eat this and maybe you should not stress so much because stress is, killing your chances, and maybe you just need a vacation. And ultimately, I think that there needs to be trust in the team taking care of the patient. If you've chosen well, hopefully you trust them to let them do the science part. And if there is a diet or a mental health professional or a genetic counselor, we absolutely refer. And to, as a support person, really just be the ear and the voice of hope and reassurance, because the nice thing about my field is that most women move on from me. I have a very, very few patients that can't move on because their diagnosis is that hard. Most will, some will their first try, and some won't their first try. And that's unfortunately just part of the statistics. But to not change too many variables too quickly is always a good systematic approach. And sometimes when patients are being told to read this book and do this, they come to me with all these things they want to change for the next time. And it really takes a lot of counseling to say, sometimes we just need to try again without changing anything. And I think that that's probably the best advice I can give as somebody who's had many patients with their parents involved. Obviously, there's a time and a place to say, maybe go get a second opinion. Like, I'm not saying you have to blindly trust your doctor, but assuming you chose well and did some research, I think giving it some patience before you get there, and really just being the support person and the voice of hope is the most useful thing you can do.
Thank you, Dr. Wertheimer. And I appreciate that you also made reference to the fact that even within the office, there are interdisciplinary supports. And many of these many reproductive endocrinology offices, you're working with dietitians. There might be a relationship with an acupuncturist, therapists in-house, that this is a really comprehensive, sophisticated approach that is holistic, evidence-based, and really different, right?
Yeah, I would say so. I would say the holistic emphasis is very different between doctors. I would say also the Western literature and the Eastern literature is very different. And if you're somebody who really values a holistic input, you may want to find a doctor from the get-go that might value that as well. We do here. What I tell my patients is, there's no Western data that shows that acupuncture makes a huge difference. I personally feel like it's been around forever. It can't hurt. If you want to go to an acupuncturist, go to an acupuncturist. But I also really take into account my patient's mental status. Sometimes adding another appointment for a patient that doesn't show a certain percentage success rate and improvement is not the right thing for them. So hopefully that's also another area where, you're not, as a support person, saying maybe you should, a nice thing would be say, why don't you ask your doctor about this, but not, I think you should go see this acupuncturist or go to this person saw this person and she got pregnant. It just becomes overwhelming.
Thank you so much. I remember I was a patient of Dr. Lawrence Grenfeld at RMA. He was one of the first doctors of RMA in Manhattan. They were starting acupuncture relationships between RMA and Unova, which is an acupuncture clinic in Manhattan. And a bunch of us were asking, what's the science behind this? And it was, do it if it makes you less stressed, but don't do it if it stresses you out. And that was such a holistic and helpful approach to kind of addressing everything in infertility, that you're in this for the long run. So what works for you is in consultation with your medical provider. Really, really helpful, Dr. Wertheimer. Thank you.
Yeah.
Thank you so much. Deborah.
Yeah, so I think one of the biggest challenges that I see and that I experience with patients is that depending on what type of genetic testing they're doing on their embryos. So if it's just, the standard off-the-shelf testing for chromosome abnormalities, I find that one of the biggest challenges my patients experience is that they've gotten to this point, right? They've decided that they're going to pursue IVF, they've created embryos, they've sent the samples off for the testing of their embryos. And then getting to that point doesn't always mean that there are going to be healthy, transferable embryos available. And so I have patients who come back who've had 5, 6, 7 embryos tested with maybe one that comes back as transferable. Or with none that are clear-cut transferable, some that are a little bit of a gray area, more of an in-depth conversation that may come with a little bit of a higher risk that it may not work with a transfer of those embryos. In those scenarios, I think, I've had patients express to me frustration of feeling like this is their fault. And I think one of the most helpful things that I constantly tell my patients, and I think as support individuals of your children going through this, the most important thing I think you can emphasize is that this isn't their fault. They didn't do anything to cause this. They didn't do anything. They couldn't have done anything to prevent it. There are things that are working against us in nature, right? As we age, chances of these chromosome abnormalities increases over time. And so there isn't necessarily anything that we can do to control what the outcomes are going to be. I think you can be encouraging and say, I'm hopeful and optimistic that in a future cycle, you will get transferable embryos. You will have something that could be successful for you in the future. But I think it is important to know that getting to the point of creating embryos, setting them up for testing doesn't guarantee success. And I think Dr. Wertheimer can talk about also as well, even having a normal embryo come back as tested on this genetic testing doesn't also guarantee that that will be a success with the transfer. So I think it's important to know and be aware of, even though you're kind of crossing all these finish lines during the process, until you have a baby in your arms, it doesn't feel like you've actually crossed the finish line. So
I think that's a great point. A really good mantra for everyone to live by is that it's not your fault, because that's also what the science tells us, and something that that's part of the background behind acupuncture isn't going to fix this, or this isn't going to fix this. If there was one solution and you weren't doing it, we would all know about it by now. But unfortunately, it's just so beyond our control.
yeah. And I will say, the other challenge I have patients experiencing, and this is obviously a very case-by-case basis, but if your child is doing IVF because they have a known genetic condition, there's a lot more involved in that process. It requires financially more from your children as part of creating those tests. It requires oftentimes collecting more samples of DNA from them. It potentially involves you as part of the process as their parents. Oftentimes we're requiring that their parents go for genetic testing and their parents provide DNA samples as part of the process. Those tests for those, genetic conditions we had talked about before, things like Tay-Sachs or cystic fibrosis or BRCA, those require a period of time to actually build a test that can be used for those patients. And so there's even more waiting. There's even more financial burden. There's even more involved in getting to the finish line with that part of the process as well. And so I think if any of you are experiencing that with your children, I think one of the most helpful things you can do is say, whatever you need, I'm happy to do, right? If you need me to go to my doctor and get a blood draw, I'm happy to do it. If you need me to call my primary care provider and see if they can order the genetic testing for me, I'm happy to do it. That, I think, alleviates a large mental burden for our patients who are going through that type of genetic testing as part of their IVF process.
Really, really helpful, Deborah. Thank you. And I just keep on thinking about how your field has changed. It has changed so much, so quickly, that the names of the tests, the types of tests, the sophistication of the testing, the genetic disorders that can be tested, and really, really, like we were saying, knowledge is power, but to have that support system really sounds like it can be really, really helpful. Wow, thank you. And Kenzie.
Yes. Oh my gosh. I'm so glad, Deborah and Dr. Wertheimer, that you're both touching on the mental health of all of this and it's not your fault piece. And I think that that's, incredibly important. And I think that's also something that comes up a lot in their support system, who maybe may not be as involved with infertility and have as much knowledge about it, is, well, what did you do and what can you do to fix it? And, can you just eat better? Or can you just do XYZ? And so I'm glad to hear that, at least we're educating this lovely group of people tonight. So some pieces, I would say, some challenges that the grandparents in waiting should be really aware of is that we haven't already been touched on. A lot of them have been touched on that I was going to share, but that to keep in mind that your children are making really complex decisions at times, and they're often very private decisions that take some time to come through. And so recognizing that this is not always so quick of, do we just go do this or just go do that? And it's, we still hear quite a bit like, just adopt. This isn't worth all this trouble. Just go adopt a baby, which is not simple either, by any means. And so really allowing your child the space to make a complex and private decision if they're partnered, making it with their partner, and also respecting that they may not be ready to share what they're exploring just yet in terms of their decision. There's often a really big pressure to give updates, to everyone around you of, how's it going? Have you seen the doctor? What did the doctor say? How was that cycle? How's your medication? And it may just be, those closest asking for updates, but it could also be a wider community of friends. And while one is making very complex and private decisions, this push for updating and sharing every private detail can really give a lot of pressure as opposed to support. And as an incredibly curious person myself, I would be that grandparent in waiting. I'd be like, so what's going on? How can I, can you just let me know what's going on so I can support you? But finding ways to offer support that aren't necessarily directly linked into these complex and private pieces, but really just an overarching "I'm here," can really go a long way, and then actually being there. But I think that's a pretty large challenge. I think also just being in community spaces where there's often assumptions that as much as, yes, infertility is talked about in ways that it has never been talked about before, there are still plenty of spaces that assume that everybody who wants to be a parent can be a parent and is a parent. And if you aren't a parent, it's because you either don't want to be one or you've done something wrong. And so really giving space for, if your child is struggling in any way with being in a community space, attending certain events at certain holidays, trying to find ways to understand that, I would say, is also important. And I would say also this may be the wrong crowd to say this in because you're all here, which tells me a lot about all of you.
Right. It's
We
almost,
need,
it's almost like self-selecting here. I
right.
can't.
I know. I was like,
This is,
I was
this
like,
is,
can we get
yeah.
like a billboard
But
or
I think
something?
like I really appreciate though how you're touching on the fact that this is complicated. This isn't so simple, and
No, nothing is.
what would be helpful could be really, really comforting in
Right.
that some people do want to share, some people don't want to share, and maybe
Right.
depending on your relationship with your kids might also navigate how you're going to be that support system.
Right. And I would just, not to interject, but like, yes, of course, based on the relationship you have with your kids, but also you could have the best, most close relationship with your kids. And this topic may just not fit into that model just right now. And they may need some space, even if you are, your son or daughter's best friend and you're with them all the time. This may not be the topic. And that can feel really hard when you're not used to these boundaries, in
Right.
any other way. Suddenly they can't talk to you about this. And so it may feel like the right thing to push or to really show like, hi, but we're best friends. And listen, I get that. My mother-in-law is here like 4 times a week and she's the best thing that ever happened to me. But like, I wouldn't necessarily want to divulge all of this to her. It just may not be where I am. And so really giving them the space and saying, I don't know how you want me to show up. Can we talk about just how you need me to be so I can try to be that? And just one other piece with it is also there's often a really big ask for folks to educate others. Can you tell me all about your diagnosis? Can you explain what IVF is? Can you tell me what this medication does? And to some extent that may be fine. That's really person by person, like all of this, we need support in different ways, but we also are all blessed with the internet since we're all sitting here on Zoom. And so Googling and trying and looking at reputable websites for some information of, how does IVF work aside, instead of having somebody, your child explain every step of this medical procedure. But like I said, you're all here. So clearly you are out here educating yourself already. You're not necessarily asking your child to do so. So as I said, we should get a billboard.
Amazing, amazing. Thank you, Kenzie. And I'm just looking at the hour, and over the next few minutes, maybe we could take a moment to think about the different types of grandparents in waiting and really what might be helpful. There are grandparents in waiting who have grandchildren, might have grandchildren from other children. You may have a grandchild or two or even three from your child who's going through infertility, secondary infertility, and what that might look like. Maybe we could just take a little time before we wrap up to really impart any helpful guidance to share with grandparents in waiting, based on the fact that infertility is really a diagnosis, but it's if you have one experience of infertility, you have one experience of infertility, and that a child might go through different types of infertility and their needs might change over time and what that might look like. So before we wrap up in a few minutes, just we can go around one last time to really think about what would be helpful as your last thoughts, really thinking about infertility and pregnancy loss as kind of like a vague idea that can change and does change, and what might be helpful to grandparents at different stages based on your experience and your expertise. Dr. Wertheimer?
I'm sorry. So the question is like how it might change over the
Yeah,
course
like
of.
acknowledging that this is a fluid experience, and if there's anything that you might want to just end by saying, thinking of if you have any closing thoughts or ideas.
I'm not a huge fan, and I defer to the mental health professionals on this one, but I am not a huge fan of blanket statements or mantras when it comes to patients and their mental health. I know there's a lot of accounts out there that are like, they say things like, for example, when is it okay to ask someone if they're pregnant? Never. I actually don't believe that. I feel like if someone looks like they're super, super pregnant and it's really, really obvious, you can comment on it. I think you just have to read the person in front of you. And I think that as parents, hopefully we're all like in this, chat, somewhat intuitive and empathetic. I think that as parents, you know your kids, and it's about also trying to read their body language and what they would want from you and responding in a way that you think is appropriate. And not overstepping. I don't know that I don't feel qualified to give like a blanket statement.
Right. And I think that's, I guess, thank you for clarifying. It was more just if there were any thoughts that needs might change, and that prescribers might change and situations might change. But I appreciate that, because it is nuanced, and a couple's journey when they get married might look, or when they start for family planning or moms by choice, might look very different over time. And to really, I appreciate how you're really focusing on the authenticity of the relationship and to check in with your children. And that seems like really, really
Yeah,
awesome.
I've gotten a lot of great taglines from Yesh Tikva. I would love to hear what Kenzie or Gila has to say. Yeah, definitely the start of a fertility journey can be so different than the middle or even towards the end. Patients can come in I think one of the most telling things is that patients that do their first transfer, almost all of them think they're going to get pregnant with their first transfer, even though we give them the statistics and 70% and whatever, which 30% is quite substantial that doesn't get pregnant with their first transfer, but nobody hears that. And then after the first transfer, it's like all of a sudden this reality of this roller coaster that they're on sets in, and that's a very different patient than the one that sat in the first time. So, and that's like just one example. So I can imagine that it changes quite drastically. And I would defer to, that's the perspective I can give from a medical perspective. From a medical perspective, but I would defer to Gila and Kenzie on what they think the right taglines are to say to patients, and I don't know.
Thank you, Dr. Wertheimer, and Kenzie. Well, I know you had asked to go a little after the other speaker, so I'm going to.
Go.
Oh, it's okay.
So whatever. Yeah, I can. I
Probably
can
doesn't
go.
want to take
okay,
all the thunder away from us because she knows all the answers. She's just trying to let us say something, but I don't know. My personal styles, I try to go off of what my patients are giving me, but then beyond that, I'm like, okay, go see Kenzie.
And I think that really speaks to the fluid nature of this and the interdisciplinary nature of
Yeah,
this, that what you need at one point in your fertility journey might look really different than at another, and to stay
totally.
open-minded and to stay flexible, and as grandparents to be able to pivot as well. You know, if they have older kids at home and going to treatments in the morning is really difficult, can you offer, you know, I'm going to be there in the morning to get your older kiddos to school, so that's one less thing you have to worry about. Or if you have to
Mhm.
do a transfer and you have to stay close by to whatever office is doing it, that I can sleep over, or your kids can come to me. And those aren't necessarily the financial pieces of it, but it's that emotional piece
Logistics.
of creating a holding space for your kids to be able to do what they need to do to grow their family. So that's really, really helpful, Dr. Wertheimer.
And just
So
one
Kenzie, please. Yeah.
I wanted to just add one more piece for Kenzie to maybe address. I see that there's a question in the box, but I think something that's really interesting that I see all the time on accounts like Yesh Tikva or other Jewish fertility accounts is this piece during the holidays of patients being with their siblings who are having kids without issues. And I think for grandparents in waiting, that might be a really great topic to address. Like you have one child that's having no problem, has four kids on her hips, and then another one that you know is silently suffering.
We have a resource for that. As silly as that sounds, we do,
Love to
about getting
hear
through
it.
holidays. It's so, you know, as a grandparent in waiting, and it's already grandparenting through a different child. So we can certainly, I don't, Gila, is that one up online yet, or just printed? Are you able to maybe grab the link and put it in there in the chat if anybody is wondering how to deal with that? We have a resource for just about anything, and if we
And just
don't, please
thinking
let us
about
know.
resources, Yesh
Yeah.
Tikva has the Infertility Awareness Shabbat, where they offer packets, and there's a ton of resources online. It sounds like Gila's sharing it in the toolkit. But in
Yeah.
addition to that, really thinking about other supports, whether it's in your own community, whether it's Yesh Tikva, but being able to lean into your own support system while your
Yes.
kids are struggling can be really,
So
really
yeah.
empowering as
That's
well.
a great little segue for me, Rachel. So I'm gonna share a quick visual, because I am a visual learner myself. So can everybody see this little thing? Nod, yes. Okay, great. So this is called the ring theory in non-Jewish spaces, but here we call it the kvetching order. And so really the idea of it in the most simple of ways is this is the folks who are going through infertility. It's a very sad looking cartoon. Unfortunately, that's kind of what the clip art gives you of people who are going through. And the idea is that the rings around them are their community. So those closest to them are probably you, their parents. There may be their siblings, their closest friends, and then we're moving outward toward maybe other friends, acquaintances, their work, the Jewish community, etc. You know, we're moving out and out until we have people that they do not know. And so, what we really want for these folks is that they know that they are going to receive support and around their infertility, and that they don't have to take care of people who are on these outer rings around their fertility, which it may sound very silly when I present it that way, but that's not unusual. We will have folks in our amazing peer support groups saying things like, you know, I don't know what to do about my sister. She keeps saying she desperately wants to be an aunt, and I'm the only one who can make her an aunt, and I want her to be an aunt. She'd be a great aunt. But like, how do I do that when I'm going through infertility and feeling pressure to give titles to their loved ones of grandparent, aunt, uncle, etc. And oh, my brother has 3 kids already, and I want my kids to grow up with his kids, but his kids are already 3, 5, and 7, and so I'm behind, and so it feels like my kids aren't going to have cousins their age, and I want that. And he keeps saying he wants that. And as much as that, it's not like these people are complaining. Kvetching makes it sound like they're coming and they're like, oh, your infertility is ruining my day. But it's really just that it's creating pressure. It's just turning up the dial a little bit on the pressure when their pressure is already really, internally through the roof. And so the idea is we want the support to come in from these outer rings to the person going through infertility, and that they can sort of kvetch, complain, request support, etc., going out. But what that also means is that the folks who are on, like, let's say an outer ring, let's say this is a grandparent in this little yellow ring, they are not going to be complaining in. They're going to be complaining or unloading or venting or struggling. Kvetch makes it sound incredibly negative, but really it could be that you just need emotional support. You feel terrible that your child's going through infertility and it's breaking your heart to see your kiddo go through something. You wish you could fix it and you can't. We don't necessarily want to bring that in. We don't want to go, I just wish I could fix it for you and it's breaking my heart, because then they're like, well, my infertility is breaking their heart. Nobody wants to do that to their parent. So we want to take that out. We want to take that to maybe your own therapist, your own peer support, folks that also know that your child is going through infertility. We don't want to blast that out to the world without their permission. But if other folks know, you may be taking that out and going, I'm just, you tell your sibling, my child's going through this. I'm really struggling because I want to fix it. I can't, instead of bringing it in. And you want to bring the support in. You don't want to expect them to be supporting you. You want to support inward. And so we already had a lot of great touching on how to do that, but I'm going to just drop a couple more. I like the word taglines that you were using, Dr. Wertheimer. I'm going to drop a couple more little taglines. Um, so we want to be present. We don't want to be pushy. So figuring out how to follow your child, like Dr. Wertheimer said, if you feel your child, because I don't like to assume that everybody feels a very close relationship to their child in their adulthood. Some absolutely do, and I also want to respect that not all relationships are easy, and then infertility also can come in and make it even more difficult to sort of manage the relationship with your child. So trying to let them set the tone. If you are having trouble reading them, asking them, I just want to make sure I'm here for you in a way that helps and doesn't hurt. Can you let me know what that is? Does this feel like it might be helpful? They may not know. That is also okay. Um,
So really keeping
so
it open-ended, that this can be an ongoing
yes,
conversation. I'm here for you
absolutely.
unconditionally.
Right. I'm
What you need
here.
now might be different than what you need later.
Right.
We love
Right.
you and care about
Absolutely.
you.
And it can change if you want to talk to me about this today and then you don't want to talk to me about it next week. You just want this to be a one-time conversation where you unload. Great. I'm okay with that. Being that soft place for them to land, like parents are to younger children, be that soft place for them to land. I also think, yes, coming into the relationship with hope is wonderful, but also there is a lot of, it's going to work out, don't worry about it, like it's all going to be fine. And while statistically it absolutely is more likely to be fine than not fine, when you're deep in it, that can be really hard. And it can also feel like I can't talk about this to anybody, because if I talk about how much I'm emotionally struggling, they're just going to tell me to, keep my chin up and it'll be fine. And
Mm.
so if they want to, you know, unload and vent to you, giving them the space to do that and just be that listening ear. And, as opposed to trying, saying it'll be fine, it seems to me kind of like a way to try to fix things without actually fixing anything. And so really letting them have their emotions. All emotions are valid, especially when, facing something so difficult. I would also, I know we're running around. I'm sorry. Go ahead, Rachel.
No, and I was, in addition to all emotions being valid, also what parents say matters, meaning that the
Yes.
permission of, if you need space, you have it. If going to this baby naming or going to this bris or going to this next family function is just too much for you, or doesn't work with your schedules, meaning you're going to the reproductive endocrinologist a few times a week, you're doing the genetics pieces, you're doing the blood, that we understand. We love you unconditionally. And as someone who's done research in infertility and pregnancy loss, I've interviewed women who have had abortions, and many of them for medical reasons. The one thing that we've heard from Jewish women who unfortunately have had to make very difficult decisions is that they knew that their parents were there, that they had their parents' unconditional support, whether it was financial or emotional or physical, meaning taking care of their other children, that knowing that the conversation was open when things were okay or not so great, but that when things went really, really difficult, that the door was still open, was really, really a tremendous amount of support. So I just want to throw that in there, that
Yes.
additional love and support can be really helpful in good times, but also when things go wrong.
Yeah. And I think that answers really beautifully to the, like you said, the question in the chat from Debbie of just,
Mm,
it's not as just, you don't have to fix it. You don't have to know every last thing to fix it. Really what folks are looking for when they're in this is somebody who's there. I love you no matter what happens. Whatever happens, your life is going to be okay, and you have love around you, and we will be here. And what can we do? Let me know. Here's what I think I can do. I think
mm.
also just I didn't forget to just take this picture down. I have it up here for a reason still for a second, and then I promise I will take it away. Um, but there are ways to offer consistent and quiet love. And I think consistent, quiet love can feel hard to give because it feels small in comparison to this huge thing going on in their life. But the consistency of showing up and offering your unconditional love is important. And so it may just be if it's something that they are comfortable with. Again, not everybody wants love the same way. And so you really either know your child or ask your child. I don't like I'm a big fan of asking even if you know your child in and out, because I just don't like assumptions.
And
That's
also
just
they're
me.
going through something that they've never
It's
experienced
new,
before, right?
right?
That
And so
things can
what
change.
may
That
work
can be really,
before.
really helpful. Yeah.
Yes, I agree. So things like a text of just, I'm thinking about you this morning, wanted to let you know I love you. I hope you eat something good today, something like that. Speaking of eating something good, as we are Jews, we show our love through food, in my opinion. And so like, hey, I made extra dinner. Can I drop it by so you have some leftovers? Hey, I actually was thinking about making this favorite meal from when you were a kid. Like the warmth of, your parents cooking as an adult of your favorite childhood meal, like, it might be really special. Again, your kid, but if you're nearby, I understand not everybody's nearby, but just to show your thinking of them and checking in without expectation. So instead of texting a bunch of questions, after an appointment or after a transfer, how to go, how do you feel, what's going on? I just want you to know, you've been on my mind. I am sending so much love your way, during this time, as Karen said, time is a really large stress factor. So just sending love during stressful times, if you know that there are stressful times, you may not always know, um, can
And
really
maybe
go a
also,
long way.
and just
Yeah.
thinking about this, how do you take care of yourself and how do you take care of the other family members and how do you mitigate or how do you kind of be that helpful boundary that might be needed, can
Mhm.
really kind of all fit
Yeah, so
into
if others are
already where
asking a
they're
lot of
at. Yeah.
questions,
Yeah.
yeah, if others,
Yeah.
yeah, I would say, respect your child's privacy. If they have shared something with you that they don't want your other children or other relatives to know, that's their decision. It's not yours, even if you think it would help. Oh, they're not showing up to any of these events. And if everyone just knew what they were going through, then they would
Right.
understand. It's not for you to decide. That's for them to decide, and really respect it every way you possibly can. Um, but if your child wants you to be that buffer, to me, that's an honor. Honestly, it may feel uncomfortable, but it shows how much they trust you, that they feel like they you can be that buffer. We've had folks who they've had their parents break the news to the siblings because they just can't tell everybody. So here's what can you just tell them, we're going through this. Don't give them too much information. I don't want to answer their questions. Just let them know. So,
Right.
can you please ask grandma to stop asking me why I don't have a baby yet? Just, I cannot
Mhm.
ask grandma myself.
Right.
Can you ask grandma? Those
Right.
kind of things can
Doesn't cost anything, but it can
really,
be really, really
no, but it
helpful.
can be
Right. Right.
really helpful, and to,
Right.
deflect if you see, oh, they did show up for this event, but they're clearly struggling as the kids are all playing on the floor, taking them by the elbow and going, hey, why don't you come into this room with me and let's, have a piece of challah. Like, let's get together over here. Can you want
Right.
some? I'm big on food and I'm
Yeah, no,
hungry,
this
so
is,
that's just where
and
I
I
am.
think this is a really helpful
Is
way to
always the
kind of wrap this
answer.
up, that the love and the support is invaluable. That
Yeah. And it doesn't
when
have to be grand
your
gestures.
child or children are navigating infertility, when they're navigating pregnancy loss, that having these uncomfortable conversations can be really, really helpful for both good and bad times, right? To know that you can be a source of support, but also a source of comfort. And I just want to thank Deborah and Sahar and Kenzie for coming here together tonight to educate us and to share the amazing work that they're doing with individuals going through infertility and pregnancy loss and sharing their knowledge and their expertise. So with that, I just want to thank all of you for coming here tonight, for supporting Yesh Tikvah, for supporting your children. And thank you to Gila and Kenzie and Sahar and Deborah for being here. And I look forward to meeting everyone again, hopefully for celebrating